And that's the most important thing. We want to assist the body in everything it's doing, including the inhale and the exhale. So if you start to use the musculature to assist the lungs, it takes the load off the lungs. And that's the main thing, is to help the lungs. Good. Hi, thank you for coming. My name is Justine Shelton, and I'm a certified Viniyoga Therapist. And today we're going to talk about yoga therapy for lung health. So there's a lot we can do with the structure of the body to help with breathing. Opening up the intercostal muscles that run two directions between each rib. When those are constricted, it makes it a little bit harder to take a deep breath, and we start to do chest breathing. And those shallow breaths that are started with chest breathing can create anxiety and a whole number of other things. So we want to really be able to take deep, full breaths. And the other thing, we're going to do a little bit of exploring. Go ahead and round over like this, and then try to take a deep breath. It's a little awkward, isn't it? So you want to sit up tall, getting the axis, the skeleton, as tall as we can. And then we're going to invite our arms to help us, because if you open the shoulder girdle, that also helps with expanding the lungs. So we'll start with our hands on our tummies. As we inhale, spiral the arms out, squeeze the shoulder blades together and take that deep breath. And then exhale, let your hands come back. And do that just a couple times. Inhaling, opening up. Exhaling back. Good. Inhaling, opening up. And exhaling back. Now, to get into the intercostals, we don't spend a lot of time in life laterally reaching to grab the pancake mix or whatever we're doing. So we tend to be more linear. What we want to do with our yoga practice is really work on opening that side body. So we're going to imagine our back is flat against a wall, so we're not tempted to rotate. And that will allow us to get into those intercostal muscles. So place your left hand on the floor and inhale, raise your right arm up tall. Exhale, pull the belly in, and you're going to tilt over to your left. Good. Inhaling, coming back up, lengthening. Exhale, belly in as you tilt over. Good. Inhaling to come up. Exhale, belly in as you tilt over. Then inhale up one more time. Exhale, tilt over, and we're going to pause here to take some of the tension out of the shoulder. You could place your hand on your head. And then I notice my arm is rolling forward, so I'm going to try and point that elbow towards the ceiling. And you can press into your left hand to ground that right sitting bone. And imagine my hand is on your rib cage, and you're trying to breathe and direct the breath into my hand so that you're pushing my hand away. Now wait for your next inhale. That's going to help you up. Let both arms come up, and then exhale. Release your arms down. And now just pause for a moment and take a couple deep breaths. And see if you notice anything. You might feel a little more freedom in that left side of your rib cage. I'm big on comparing sides so we know why we're doing this. So we're going to take that to the other side. Draw the shoulders down and back. Inhale, raise the arms up. Exhale, belly in. We're going to tilt over to the second side. Good. Inhaling, coming back up. Exhale, belly button to spine as you tilt over. Inhaling to come back up. Exhaling over. Inhaling up. This time we'll come over and stay over. Maybe setting our hand on our head, rolling that top shoulder back, pressing your right hand into the floor to really ground the opposite sitting bone, and then breathing into that side of the rib cage as though you're trying to push my hand away. And just notice for a moment if you're clenching your jaw. Oops, I just caught myself pushing my shoulder up into my ear. Try to soften those muscles you don't need to be working. Now Now with your next inhale, that's going to help the breath come back up. And then exhale, release. Pausing there and just feeling the effect. Maybe taking a deep breath and just noticing if that feels a little bit different than when we first started. Now, with any sort of lung condition, it could be that you have a common cold, it could be that you have emphysema, or anything in between. Regardless of if the issue is inhale or exhale, you want to work on lengthening exhale to strengthen the lungs, because that's what strengthens the alveoli sacs in the lungs. And if you work on lengthening inhale, that can cause the body to revolt and react. So one of the best things I like to tell anyone, I even told a woman I just met at a restaurant the other day she had to move from New Mexico because her COPD was bad enough that the altitude was stopping her from breathing. So I call it sniff the rose, blow the candle, but it's flicker the candle. And this is like a workout for the alveoli sacs. So you can imagine you're smelling the rose, and then you're pursing your lips and gently blowing to make the candle flicker. And that exhale could go on, and then inhale, sniff that rose again. And exhale, doing that gentle blowing through pursed lips. And that is like a workout for your lungs that will help strengthen them from a little kid to someone 100 years old. And that I really like to tell a lot of people, because it's one of the safest things you can do to strengthen your lungs. The other thing, and the main respiration muscle, is the diaphragm. And the diaphragm, people, I always thought it kind of comes to here. It actually is this dome that comes up very high. And it's an important muscle. It separates the visceral organs from the heart and the lungs. And it can also get adhesions around it through all the fascia. So if you reach down to where your ribs are, kind of round over a little so you don't hurt yourself. And you're gonna dig in there and just kind of almost like you're trying to pick yourself up by the rib. Maybe not quite that intense, but just softening the belly and relaxing. And those of you at home, another way to do this would be to lie on your back with your knees bent, leaning into one another, because then you can soften the belly a little bit more and work on that massage. But that's something nice to do, especially this I've learned through years of practice with clients. That's where the magic happens. That's where you really learn, is people with their real body and their real experience. And I had a woman who had scoliosis, and the scoliosis was severe. It was pulling her down like this. She was in her 80s. And I would ask her to take a breath, and she said how much it hurt. So through inquiry, I was able to figure out she had abdominal surgery, abdominal surgery, abdominal surgery, abdominal surgery over the course of her lifetime. And what was happening was the scar tissue adhesions were affecting the diaphragm. So she did that for a couple weeks. It not only helped her breathing, it helped her posture to be able to come up more upright. So a lot of times it's these little things that you can do. It's not rocket science. It's just knowing your body and being familiar with it and rubbing it, touching it, moving it. Yeah. Okay. I'm going to pause for just a minute, just because okay, good. Yeah. Some of the stuff I realize as I say, I'm like, oh my God, I'm not going to be able to do this because of the camera. But one of the best poses that's good for the lungs is fish pose. And fish pose is actually considered the destroyer of all disease. In some of my research, that's one of the, and I'll never forget that. It was when I was a new teacher, and I'm like, wow, remember this one. Because you're going into a back bend, you're stimulating the lungs, you're stimulating the kidneys, you're stimulating the immune system through the thymus. But for today's purposes, some people can't do fish. Traditionally, it's done on your back and pulling yourself up into a back bend, maybe even balancing on your head. There's ways to adapt and just turn gravity. So I'm going to turn sideways so you guys can see this a little bit better. We're going to do a couple variations. You can place your hands behind you. What we want is the squeezing together of the shoulder blades, and then inhaling, lifting as though someone's lifting you up by your sternum. And then only if it's comfortable for your neck, you could lengthen through the crown of the head and then look up and back. And that's going to get a little bit of stimulus on the thyroid as well. Breathing deeply as though you can expand your sternum in all 4 directions with the breath. This is great for doing in a chair too. You can sometimes even use the arms of the chair to squeeze together and lift up. Now with an inhale, lift your head back up, and then exhale, soften around the rib cage. Roll your shoulders a few times. Good. Okay. As long as we're seated, I want to show you, there's some acupuncture points that will help the lungs. So if you reach across, I always have my little band on, reach across and grab the opposite shoulder with your right hand, either hand. You're going to take your thumb and walk it in, and you'll feel a little bit of a divot. You're going to go to that divot and then slide a little bit towards the middle of your body and start to press that finger, your thumb around in that point, and it should be a little sensitive. That's why it's better to do to yourself than to have someone else do it, because you can stop it before it gets painful. The pain is actually not a good sign, but that's telling you you're on the spot. And it's right adjacent to a shoulder point for pain. So if it's sore, rub it. Because the sore is symbolizing chi is blocked, so you want to keep the chi flowing. And then release that. Maybe feel the difference. Maybe it feels like it quits hurting now that you're not pushing it. And then we're going to take that to the other side. So grabbing the shoulder, dropping the thumb to the inside, and feeling around for that little divot. And as long as you're in the general vicinity, you're going to get it. And the nice thing about these acupuncture points is they extend beyond the body out into the aura. Now we're getting a little woo-woo on you. But I remember learning from an acupuncturist who talked about that's why Reiki or energy healing has the same effect, because you're affecting that energy line in the aura. I don't know about you guys, but I'm a little sorer on one side versus the other. Yeah. Good. Okay, release that, roll your shoulders. The other thing, sometimes we get into this, they'll call it chest breathing, where it's up here. And these muscles up here help with breathing, but they shouldn't be the primary breathing muscles. The diaphragm and the intercostals, freeing that helps make it much more efficient at breathing. But what happens, that dome that comes up as you inhale, the dome pushes down so that your visceral organs get a little bit pushed out. And then as you exhale, the dome comes back up. And really, we think we control the inhale, but at a certain point, atmospheric pressure, there's going to be a signal in your body that the CO2 is getting too high. And I mean, this is downplaying it a little bit, but then the diaphragm will start to contract, and atmospheric pressure senses that, and the air comes in. So you can't hold your breath out for too long and make yourself pass out. It's impossible. You can hold your breath in for too long and make yourself pass out, and I don't recommend it. But you can see little kids do that when they're mad. But it's impossible to hold your breath out. The body will bring it back in. But try pulling your belly in strongly, and then try to take a deep inhale. Also feels constricted, almost even more so than that hunching did. But it's not that we're breathing into the belly. What's happening is the air comes into the chest, the diaphragm pushes down, the belly goes out. So try to take that breath, not like pushing the belly out, but letting it happen naturally. So inhaling, and then exhaling, initiating the exhale at the pubic bone, drawing the belly in all the way up to the ribs. Then inhaling, softening the belly from the top down as the breath comes back in. And exhaling, pulling the belly in. That helps to expel the air. And then inhaling, letting it back in. Good. Good. How does that feel, ladies? Good. So some people have trouble with exhale. Some people have trouble with inhale, depending on the condition of the lung. If you have healthy lungs, count your blessings. And helping with the exhale, because if we're trying to exhale from up here, that's not good for a lot of reasons. But if we can assist in the exhale, because what happens is the elasticity in the alveoli sacs can start to become affected from different conditions, fibrosis, emphysema, different conditions can occur. But if we use the core to help push the diaphragm up, that's going to aid in the exhale process. And that's the most important thing. We want to assist the body in everything it's doing, including the inhale and the exhale. So if you start to use the musculature to assist the lungs, it takes the load off the lungs. And that's the main thing, is to help the lungs.